The sutures of the skull are immobile fibrous joints that are found between adjacent cranial bones. They function to anchor the cranial bones together tightly, but they also still permit the growth of cranial bones during childhood and adolescence. There are 4 suture joints that we will focus on. The first is the coronal suture, which is the joint that unites the frontal and the parietal bones. The squamous suture is the joint that unites the parietal and temporal bones. The sagittal suture unites the right and left parietal bones along the superior midline of the skull. And then finally, the lambdoid suture is the joint that unites the parietal and the occipital bones. In figure 7.5, we can examine 3 of the major sutures that were previously mentioned. The coronal suture runs along a coronal plane, uniting the frontal and parietal bones together. The squamous suture on the lateral aspect of the skull unites the parietal and temporal bones together. From this perspective, part of the lambdoid suture is also visible, which joins the occipital and parietal bones. The sagittal suture, which joins the right and left parietal bones along the midline of the skull, could be seen from an overhead view of the skull, but is not visible here.